This video is about sleepwalking disorder. Between 10% and 30% children have had at least one episode of sleepwalking, but the prevalence is probably in the range of 1% and 5% of population. The essential feature of sleepwalking disorder is repeated episodes of complex motor behavior initiated during sleep, including rising from bed and walking about. Sleepwalking episodes begin during slow-wave sleep and therefore most often occur during the first third of the night. During episodes, the individual has reduced alertness and responsiveness, a blank stare, and relative unresponsiveness to communication with others or efforts to be awakened by others. If awakened during the episode, or on awakening the following morning, the individual has limited recall for the events of the episode. After the episode, there may initially be a brief period of confusion or difficulty orienting, followed by full recovery of cognitive function and appropriate behavior. Sleepwalking episodes can include a variety of behaviors. In mild episodes, the individual may simply sit up in bed, look about, or pick at the blanket or sheet. More typically, the individual actually gets out of bed and may walk into closets, out of the room, up and down stairs, and even out of buildings. Individuals may use the bathroom, eat, and talk during episodes. Running and frantic attempts to escape some apparent threat can also occur. Most behaviors during sleepwalking episodes are routine and of low complexity. However, cases of unlocking doors and even operating machinery have been reported. Particularly in childhood, sleepwalking can also include inappropriate behavior. Most episodes last for several minutes to a half hour. Sleepwalking episodes can terminate in spontaneous arousals followed by a brief period of confusion, or the individual may return to bed and continue to sleep until the morning. Not uncommonly, the individual may awaken the next morning in another place, with evidence of having performed some activity during the night, but with complete amnesia for the event. Some episodes may be followed by vague recall of fragmentary dream images, but usually not by typical story-like dreams. During sleepwalking episodes, individuals may talk or even respond to others' questions. However, their articulation is poor, and true dialogue is rare. Individuals may respond to others' requests to cease their activity and return to bed. However, these behaviors are performed with reduced levels of alertness, and awakening an individual from a sleepwalking episode is typically very difficult. If awakened, the individual remains confused for several minutes and then returns to a normal state of alertness. Internal stimuli, for example a distended bladder, or external stimuli, for example noises or heat, can increase the likelihood of a sleepwalking episode, as can psychosocial stressors and alcohol or sedative use. Fever or sleep deprivation can increase the frequency of sleepwalking episodes. Obstructive sleep apnea syndrome and other disorders that produce severe disruption of slow-wave sleep can also be associated with sleepwalking episodes. An association between migraine headaches and sleepwalking disorder has been noted. Some individuals with sleepwalking also report episodes of eating during the night, most often with complete or partial amnesia. They may find evidence of their eating only the next morning.